A very, very common question I get is, how much do I exercise when I'm getting the trigger point therapy done? And this has taken me years of experience to learn that most commonly, most people will tell you exercise more and your pain will get better. But when your muscles are injured, how do you expect to use those muscles and exercise those muscles and get better? So that's been a common problem. And from experience, you have to first deactivate or calm the muscles down. Once they calmer and they relax, then they can stretch better and move better. So first, you have to calm the muscles down. Exercising these muscles will not make it better. A lot of people even ask me about stretching. And yes, even stretching sometimes really is of no benefit, but it does feel good. So yes, you can continue doing it. My common recommendation is that when you are getting the trigger points therapy, at least for the first 2 weeks when you're getting it, rest. The more you rest, it allows the muscles to heal and gives it a chance to relax as well. And really the main thing is about that nervous deactivation that needs to occur. Once it becomes deactivated, then there's less nerve sensitivity and the muscle is less reactive. So the first 2 weeks, rest is best. The more you rest, the better. But if you have to do something and do something very little, just so that you keep moving and you don't sit completely down as well. But it also depends on your pre-level of fitness as well. And if you've been doing an hour long of exercise before you started all this and then you still can do it, then maybe do 20 minutes only, but do something, but maybe you don't do too much. The other problem is that these muscles become fatigued as well, wherever the problem is. So if you have a shoulder problem, if you do exercises for 10 minutes, maybe you're okay, but then if you do something for 20 minutes, the muscles get fatigued and then they break. And then the whole cycle of pain starts all over again. Too much is not good, too little is also not good. Generally what I recommend is stretch or keep moving those areas that are painful. At least that feels good and you know that things are getting better. But definitely after 2 weeks, you should be 40% better and then you should know where you stand from that as well. My other general rule is that once you're 60% better, then you can definitely start a program. This program that you start in this rehabilitation should be slowly and progressive, and it should be supervised. And we have a kinesiologist, Taylor, on staff, who will definitely help you through all these rehabilitation exercises. But it's very, very important that this is done very slowly and supervised, because it's very difficult for me to tell you, oh, just do 10 of something when I really don't know where you started off with and where you are now type of thing. So the more you follow the guidelines of the kinesiologist, the better recovery you have, because it's a slow and steady progress. And really, it takes time for the muscles to heal. Most people don't realize that it takes about at least 3 months for most injuries to heal. And as you get older, it takes even longer. So you have to respect that as well. You have to listen to your body and not push yourself. When you're young, maybe less than 30 years old, you can almost get away with almost anything and just continue, not really worry about all these things. But as you get older, you have to be more careful and do it slowly. So it's important that exercise be supervised and be graded. We have a program where you are assessed by the kinesiologist, by Taylor, and we grade you into 5 different levels. And depending upon that level, we can then customize your exercises so that we can then move you along in a graded fashion that is safe for your body and that gives you the best results.